and doing AS levels at St Paul's Girls' School. Thank you.
Last winter, I attended a British Heart Foundation workshop on CPR. This was a lunchtime workshop at my school. After attending this, I realized how little I actually knew about CPR. This insightful workshop gave me a basic understanding of it, but I would not have the confidence or knowledge to be able to perform it in a dire situation. I realized that I now had the privilege of being aware of a matter that others may be less informed about. CPR is a skill that should be taught to more people, and in doing so is likely to result in higher survival rates in out-of-hospital cardiac arrests. NHS England reported that the ambulance services attempt to resuscitate approximately 28,000 cardiac arrests a year outside of hospital. Fewer than 1 in 10 people survive cardiac arrests currently in the UK, and CPR is attempted in only 20 to 30% of out-of-hospital cases. Evidence is suggested where CPR is attempted, survival rates are doubled. If we are able to increase bystander-initiated CPR from 32% to 42%, nationally we can expect to save 300 more lives every year. There are thought to be multiple reasons for low levels of bystander-initiated CPR, including lack of training and fear of litigation. Some statistics show that 71% of adults lack the knowledge and confidence to act if someone was collapsed and was unresponsive and breathing. 69% of adults polled they lack the knowledge and confidence to act if someone was bleeding heavily, and in addition to these scenarios, 81% also said they lacked the knowledge and confidence to act if a baby was choking. So as a nation, I think we can do much better. In countries where CPR is taught routinely in school, survival rates can be as high as 50%. For example, in Denmark, where learning CPR has been part of the school curriculum for children over the age of 11 since 2005. A study period between 2001 and 2010 showed that an increase in survival following out-of-hospital cardiac arrest was significantly associated with an increase in bystander CPR. During this study period, bystander CPR increased from 21% in 2001 to 44.9% in 2010. So the chain of survival. The time to initiating CPR in cardiac arrest is critical to outcome. Even the highest performing ambulance systems will be unable to get to a patient and start CPR more rapidly than a bystander who's present at the scene of the cardiac arrest. Bystander CPR is one factor among many associated with improved survival rates. So the first link is early access, which is dialing 999. The second link is bystander CPR. The third is early defibrillation, and the final link is early ALS and standardized post-resuscitation care. The cardiovascular disease outcome strategy specifically relates to improving the performance of the middle two links, namely improving the rate of bystander CPR and the use of automated external defibrillators. These are perceived to be the two weakest links in England at present. Evidence from Scandinavia and some parts of the USA has shown that targeting these areas can prove to be most impactful in terms of improving survival rates. It is hoped that increasing the number of bystanders trained in CPR will also positively impact on the first link and the fourth. The Community Resuscitation Group identified the following as its aspirations. They want to establish CPR training in all schools and mobilize relevant organizations to ensure this is done, and identify simple, consistent messages for the public and achieve greater public awareness of what to do when faced with an out-of-hospital cardiac arrest. They want to improve audit and set up a national defibrillator database, as well as ensure that all activities are evidence-based, and where evidence is lacking, call for appropriate research. So, improving bystander CPR in the UK. Here are some statistics that show how having a higher rate of bystander CPR results in a higher survival rate. So, how can this be done? CPR training can be delivered through mass training events. It can be targeted at family members of patients at risk of cardiac arrest. Mandatory basic CPR testing should be part of the driving license qualification. Community CPR training and CPR training in schools has shown to be successful. Other promising modalities include technology-enhanced learning videos and mobile phone apps, as well as virtual reality training. Another way we can improve is using bystander-assisted CPR. This reduces the time to the first chest compression in out-of-hospital cardiac arrest. Dispatcher-assisted CPR is considered beneficial and is now more practical with the widespread use of mobile phones, which enable the rescuer to receive instructions while staying with the victim. Telephone instructions to the caller increase the rate of bystander CPR and reduce the time in starting it, and so improving the outcome from cardiac arrest. The Resuscitation Council of the UK recommends everyone who is able to should learn CPR. It should be taught in all schools, and defibrillators should be available wherever there are a large number of people. Evidence from overseas has shown that training all school children in CPR can dramatically improve bystander CPR rates and survival. School children should also be taught how to use an automated external defibrillator. Evidence suggests that it could be 1 in 4 people surviving if all young people were to be trained with basic life-saving skills. CPR being taught in school could create a nation of lifesavers, and thousands more mums, dads, grandparents and children could be saved every year. From 2020 onwards, all state-funded schools in England will be required to teach first aid as part of health education. This will include basic first aid for primary school children, for example, dealing with common injuries, such as head injuries. Young people in secondary schools will be taught further first aid, like how to administer CPR and the purpose of defibrillators. There are different schemes run across the UK, for example, the Heart Start scheme, as well as Little Rescuer, which is a course designed to teach first aid in a funny way to nursery and primary school children. This is not compulsory, but it should be, as it's one of the most important life skills you can ever have. As a teenager, I realized that many people of my generation can be immersed in their phones and other electronic devices. Because of this, I believe that a technological approach to education on CPR would be extremely beneficial and would help spread awareness to engage school children on this matter. The use of technology for the implementation of resuscitation guidelines is constantly evolving. Its development should be encouraged and analysed. Social media has a vital role to play in improving the outcomes from cardiac arrest. It can be used to disseminate awareness and education on the subject to vast audiences. It's also a powerful tool for effecting change. Innovative technology falls into several categories. There's the simple delivery of information, which is apps that display resuscitation algorithms. Interactive delivery of information, apps that use the geolocation of the user to display the location of the nearest AED. Interactive delivery of education, apps that engage with the user and create an immersive and interactive means of educating the user. And also notification and activation of bystander schemes. In the next presentation, Shafali will show you that the outcome of virtual reality CPR training is the same as an instructor-led course, and technology will help us provide better pre-hospital resuscitation to reduce death from cardiac arrest.